is getting real about alcohol and drugs abuse. I'm very excited because of the presenters that we have with us tonight. They're very, very experienced in this area. They have a lot of personal experience as well as professional experience. So they're going to talk about their role as substance abuse counselors, as well as some of their experience. And then we have a medical doctor who's going to explain about addiction and treatment plans and how to get help for recovery. So I'm going to introduce our speakers very briefly, and then they're going to, but I'll want to start more about the Deaf Health Talks. This is a free service we use on Facebook Live, and we use through Zoom. We do have captioning. And so please connect with us if you need that. We've done these talks for many years now, but over the last year, we've started to increase the frequency to do them monthly. That way we have a wider reach. And we've had people from all over the US connecting with us. And the point is to provide equal access for the deaf community all over America. There are also different resources available. And in order to get these resources to people for greater access, we've decided to host these talks to be able to share and have these different presenters come and speak to our community. So now I'm very excited, like I said, to introduce the three presenters who are going to join us tonight. But before we do that, we have a lot of sponsors and volunteers that I want to mention briefly. We have two interpreters with us tonight who will be doing ASL to English interpretation. Christine Saunders, thank you, Christine, and James Check, thank you, James. We also have a CART transcriptionist, Kate Miller. And we're very, very fortunate to have a lot of support staff. We have Kayla Helm, Sanya Radhakanda, and Kanani Chilakuri. So we have a great team who helped make tonight happen. The first presenter that we have tonight is going to be Karen, and I'm going to have her kind of give you her background. We also have Misty Munton, and finally we have Dr. Michael Argagny. So first, let's welcome Karen. Karen, can you please introduce yourselves to the audience? Karen, you can go ahead and turn your camera on. We're just going to give Karen a minute so that she comes into view. Great, welcome, Karen. Okay, so the gallery view was a little bit shocking for me, but okay. Hi, everybody. My name is Karen Larson. This is my sign name. I'm very honored to be here tonight. I'm a person in long-term recovery, which means I have not used alcohol or drugs or any other kind of addictive behavior since April of 2001, 20 years. And I'm very, very grateful for the many people who have supported me over my journey so that I can be at this position today. I'd like to mention briefly about how my life was affected by this and how I became addicted. For me, it was both alcohol and drugs were part of my addiction experience. And then why I used them, what I used alcohol for. I mean, for me, it was a relaxant in the evening to kind of calm down from stressful work. It was And so I'm going to include that with my story, but also my experiences with domestic violence, and how I experienced a lot of shame. And so there are so many overlapping experiences in my life. And as they compounded, I began to use alcohol to kind of deal with that. And then it became a very difficult experience. And like I said, I thought I was in control. I thought that I was making progress. But as I continued to increase my use to 2 glasses of wine, and then 3 glasses of wine, and then 4 glasses of wine, until drinking a whole bottle or a bottle and a half, I realized I was then going from wine to vodka and then even further. And I was doing this every single night. And I couldn't remember, and then I would black out and couldn't remember what happened the next day. There were a lot of red flags, a lot of big problems looking back. So it's important for you to know that there were alcoholics in my family. My mom, my parents, my brothers and sisters. We grew up in the Midwest, and alcohol was very part of our regular lifestyle. I didn't realize at the time that it wasn't a healthy behavior. No one told me about alcohol addiction and disease. And so it never occurred to me, and no one ever asked me, like, why are you drinking or what's going on at that time? It was a very common thing for people to just drink. And people didn't ask you about your alcohol use, which is something we know better today. So growing up as a deaf person, I was in a mainstream school, which means I was very isolated quite often. It was hard for me to learn. And then it took me a long time to realize that I needed to get help. I had a lot of good friends, though, especially one who was part of Alcoholics Anonymous. And that's a recovery program. And I admit, alcohol had total control over me. I couldn't say that I was in control of my own life at that time. I couldn't change what was going on without help. And I really needed to also have more of a spiritual path that would take precedence, to be able to let go and be able to regain control, because alcohol addiction and alcoholism was really a disease that had taken over my life. So I really needed to make that change for myself. It was difficult to find interpreters. My daughter was 15 years old at that time and was regularly interpreting for me at Alcoholics Anonymous meetings. And till I was eventually able to secure regular interpreters for the work that I needed to do. So I'm sober now. I'm free. And like I said, it was breaking the addiction for 20 years. But at the same time, I realized that I'm been more involved. Now it's my professional involvement. I'm a mental health counselor, a licensed addiction counselor. And what that looks like for me is being able to take my own personal journey and parallel that with other people going through their journey. That there are lots of things. For example, people didn't know what I was going through for years. And there's a lot of shame involved in that. And so now being able to just be completely open and share honestly what was going on with me, to show people that recovery is possible and that you can get help and that you don't need to live in that shame. And it's best to be open and honest and to deal with the issue, and just deal with it, like, say, getting real, just dealing with it head on. And to be honest, the first thing we have to do is to be willing to open up, right? And not sit in that shame and be worried about being judged. I work at Massachusetts Commission for the Deaf and Hard of Hearing right now as a coordinator for substance use and recovery services. So I now train and run the deaf recovery as a deaf recovery coach in the program, which means I work with people one-on-one in the community who are deaf and hard of hearing, who have a hard time getting access to treatment. Deaf people need to have peers and need to have people who understand them and know what's going on to be able to coach them through these experiences. So I guess this is a great place to stop And I'm going to turn it over to Misty because I want her to be able to share her story with you too. And then later on, we'll be able to have some question and answer with you. So thank you so much for giving me this chance.
Hello. All right, ready? Hello, everyone. My name is Misty. This is my sign name. I am currently working at NTID, and what I do there is my agency, the program that is set up there at NTID, has been there for 40 years, and we've been working with substance and addiction intervention services for the deaf, SAISD. So I'm a substance abuse counselor, and I've been working there for 12 years. Plus, I am a RIT and NTID alumni, yes. So my story is going to be shared a little bit later, but my job has a couple of different things, so I wear some different hats. The program that I use on campus, obviously there, it's for students who are in trouble. Maybe they've gotten busted with drugs or alcohol. And now with legal marijuana, some things are changing, but in New York, that has passed. So legal marijuana is okay. I did a lot of presentations. Really, the agency that I work for is focused on prevention and education and referrals and support. So we advocate a lot for deaf and hard of hearing people that are on campus as well as off campus, people who are out in the community of Rochester, because of course there's a big deaf community there. So both of those groups we serve, and we also work in kindergarten to 12, K-12 education. For example, drugs and alcohol awareness weeks, just say no to drugs, those kind of programs that we go into the schools, some of the deaf schools, and we present there. Now we're doing a lot more things through Zoom, which is great. And that's all I'm going to talk about for right now, but I will talk about more later, okay? So I'm going to turn this over to Dr. Michael.
Good evening,
Hello,
everybody.
everyone.
My name is Dr. Michael Argani, and I'm addiction medical fellow. I'm a doctor in training, essentially, right? I finished medical school, and so now I'm doing observation and training at North Carolina. I've already completed my residency in Massachusetts, and I've got 1 year to go before I'm complete with my fellowship. So I'm here as a doctor, a specialist with this field. And I'm so excited to be here with Karen and Misty. I want to bring Karen and Misty, I want to bring them back, and I want to be able to talk about their experiences as they navigated getting services as a deaf individual, and just like what kind of self-awareness things they need to go through coming to terms with their addiction, with alcohol or drugs. And I just want them to be able to share much. So thank you, Karen and Misty, for joining me again. So for me, it seemed like, I don't know, I was just using alcohol. Like that was my main action. It was a challenge to find other deaf people who could support me to understand what I was going through, to guide me into what programs and treatment and kind of because so much was inaccessible to me 20 years ago. when I started this recovery program, they would say, you have to bring your own interpreter. That these programs didn't provide interpreters. And so really that wasn't accessible. I would just sit there. I would be in these small groups, and really it was inaccessible to me, which is very difficult to me. And I would leave, and I wouldn't want to be part of these programs anymore. As a matter of fact, I would feel worse after joining these. But when I joined AA, I do remember that they got an interpreter finally. And fortunately, Massachusetts has money set aside to provide interpreters for these programs. But I was afraid because I don't know if I knew the interpreter, would they tell people that they saw me here, that I was the person that they were interpreting for? Would they be able to follow the code of ethics and stay confidential about my experiences and them interpreting for me? And eventually I had to stop that, because I had a family, I had a job, I had a house, and it was impossible for me to manage my life at that time. I was really going downhill, and I just needed to be able to trust that whoever was interpreting for me was going to do their job. I remember going in to my first AA meeting, and when I saw the interpreter, sure enough, we knew each other, and they were shocked to see me there. And I was thinking, okay, yes, this is for those who are alcoholics, and yes, I'll admit to this problem. But I knew that it was going to be a safe environment. It was going to be a safe place for me to open up. A woman came up to me during the meeting and she said, hello, I know sign language, right? And of course, she fingerspelled a lot of it, right? But she did a little bit to communicate with me. And she volunteered to be my sponsor. And a sponsor is a person who has already gone through sobriety and the program, and they know how to keep on the right path and to walk alongside other people who are just starting out with the recovery process and recovering from addiction. They're not a counselor. They're not a professional. They're not a therapist, and they're not paid. They're only there to support those and to kind of help guide people who are new to the process through sobriety. So living without drugs and alcohol, right? To be able to support you in that decision to not use those anymore. And so what they do is they encourage you that you have to go to 90 meetings, right? That was the goal at the time. And there wasn't an interpreter every day, 90 days. That's almost impossible to get an interpreter for that frequency. But with that, my sponsor, I continued to go regardless of whether there was an interpreter, right? And then she said that she would sit with me. And if you asked me to sit in the front to lip read the presenter as best I can, I thought, no way, that's just going to put me back on the road to drinking again. But I learned a lot of challenges, and she really supported me. We worked together through this. COVID-19 really was a giant opportunity to really leverage technology, especially with Zoom. There are several types of Zoom meetings right now to support recoverers. So Alcoholics Anonymous, Narcotics Anonymous, and there are other things for family members who are also coming alongside their loved ones who are going through addiction and recovery. And so there's ones for support groups for families with Alcoholics Anonymous, as well as Narcotics Anonymous, which is for drugs. And so this whole environment has revolutionized in terms of how we approach recovery and fellowship. It's really tough for deaf people to find good connection with other people. And it's difficult to know how people go through recovery, to find the right types of group, to feel connected with other individuals in the group can be very difficult for a deaf person. Zoom meetings offer an opportunity now to really work with people's schedules. So lots of people can join and really participate in recovery. Misty, where did you go? I want you to be up here with me. I want to know, what do you think about that?
Hi.
Misty. There you are.
Yes, I do want to add some comments to your story. So alcohol really doesn't care who you are. Alcohol does not care about if you're rich, if you're poor, if you're working class, whatever you are. They just want to take over your brain. Alcohol just wants to take over, right? Same thing with drugs. So I think it's wonderful that we have Zoom, AA and Al-Anon and Narcanon meetings. It's so convenient now for people to all over the place from different states to be able to help prevent just the setbacks or the frustrations of no interpreters in specific places. That happens a lot because a lot of AA and NA places are not in the business. And so they don't have the money to pay for interpreters. They collect money from their members. They just get donations. And so you have to find an interpreter that's willing to volunteer. And often that can be the problem. Fortunately, here in Rochester, we do have a few people that some meetings that we are willing to interpret meetings, and they have really big hearts and are really helping people in recovery, which is great. People who are deaf and hard of hearing. And one other thing that I wanted to talk about, the stigma within the deaf community relating to disease, alcoholism, and drugs and use. That is actually part of the disease. Deaf people tend to look down. It's like, you have a problem. Ooh, it's like, people assume that you're on the street, you're homeless, what's the matter with you? And then rumors start going around. And so Karen's and my job is to tell people that we're not judging people. We are here to support you. And that's it. It's all confidential, right? Of course. And so people are very vulnerable and they have to open up and really trust us. And a lot of times I'm very inspired by that. So I wanted to talk about my story, if you're ready. Thank you so much, Karen. Okay. So I never knew that my grandfather on my dad's side actually was an alcoholic, my grandmother as well. And I didn't realize that until much later. So my dad told me that my grandfather was very violent, very abusive, and an alcoholic. Sorry, there's a lot of different signs that we use for that. So it was an alcoholic, and it really messed up my dad. He had PTSD, mental health disorders, post-traumatic stress disorder, because my dad relied on weed a lot, marijuana. And I saw that growing up. My dad always smoked. And he was like, oh, he's in the military, he was in Vietnam. And, he said, well, it helped me, calm down because I'd have bad flashbacks. And I was like, well, when did you start doing that? And he was like, oh, I started smoking when I was in Vietnam, just because of all of the things that I saw over there. I didn't really want to talk about it. So I was kind of naive. And so I saw my stepmom doing cocaine when I was probably like 4 years old. And my mom said, how the heck do you remember that? And I thought, it's just etched in my mind because unfortunately, as a young kid, you remember some of the more traumatic events that happened to you. You do remember some positive thing, but I think you're much more likely to remember some of the bad things. So I do remember a lot of the things that were pretty bad events in my life. I went through some abuse in the home. My first marriage, I had experienced domestic violence. I have 2 kids, and my older kid's father, who is hearing, is now in rehab. And I'm telling you, rehab and treatment recovery, he had been in there in and out many times, going into relapse and back and forth. And just because he was so awful, I just really have nothing to do with him. And the kids really don't have anything to do with him either. My life really has taken off after he was gone because he was just really a bad influence, bad energy. But prior to that, okay, backing up. So my grandfather was abusive. And so because of that, I have more likelihood of having a genetic predisposition to that. So it's kind of like a seed that I had in there, which I didn't realize I had until I got into college. And I got into a sorority and I'd go to parties, it was in the 90s and things were cool. We were partying, started drinking, and people are like, oh, take some jello shots and have some beer and here's some wine and all these different things. We started drinking everything. And I always, pretty much, probably 90% of the time, I would drink until I passed out. It was terrible. There was a couple of times I probably could have died if not for my sorority sisters or for a good friend who was watching out for me, because I would throw up. I was throwing up all the time. I was just really fucked up all the time. And I would smoke. I'd smoke marijuana while I was drinking, which I don't even remember a lot of the time. And I just partied really heavily Wednesday to Saturday night. And then I was done. And I was getting good grades. I was a 3.2 grade average. I was a social work student. I was majoring in social work and I loved helping people. And I was also drinking on the side. So I was serious in school, but then partying afterwards. So it was really back and forth. But I love working with students that are college age. My older son is 22 and my daughter is 18. And they're very open with me. We talk about a lot of things. And I think it's important for parents to talk to their kids about drugs because, I was there. My parents and my family, all hearing, didn't know any sign language. And so I always had to learn everything the hard way. I just had to get in there and try and experience everything because nobody had told me. I just had to figure it out. So I got in a lot of trouble. And so that's why, going back to my job, I really wanted to make sure that I educate people and help students see what the consequences could be if they drink or take drugs. So I wish that I had somebody like that a long time ago. So I want to give people what I didn't have. And same thing I want to be able to give that to my kids. Shoot, there was something else I was going to say, but I forgot. But I think it's important educating students and advocating for the deaf community as well. It's okay to make mistakes. It's okay to have a disease and get help for that. Don't be afraid to do that. That's really my big point for this. Oh, I remember the other thing I was going to say. Sorry. So the way I stopped drinking, I was pregnant during my senior year of college. I was 23 years old. That's my 22-year-old son. So yeah, and he's at RIT, he's hearing, but so I decided to stop drinking because I didn't want to do any damage while I was pregnant. I was afraid of hurting the baby. I was really worried about that. And I never really got help. I was really in denial that I was an alcoholic because I was a binge drinker, meaning for a woman, it's 4 or more drinks per night. So if you're drinking a lot, that's called binge drinking. For men, it's 5 or more drinks a night is considered binge drinking. So that's what that is. And there's my story. If you have any questions, please feel free to ask. Okay, and I'm all done.
So Karen, Misty, thank you so much for sharing your personal experience with us. It's so important to see like and the value here is so important for people to explain, to go through what's happening. So now I'm going to speak from a medical perspective as a doctor. There are different types of drugs, however you sign it, or alcohol, but there are a few that I'm going to talk about specifically tonight. Alcohol in particular is very common. People do shots a lot, right? It's something you see quite often. And most of us drink alcohol without problem because we can have 1 or 2 drinks of 1 or 2 glasses of wine, and that really doesn't lead to any issues. But there are things underlying like genetics, potentially your environment, that can lead to heavier and heavier use. The impact on your body becomes a chronic disease. Most people who drink, it's not so much that leads to alcohol. Most people who drink alcohol don't become addicted, but there are those who will become addicted. If you are a binge drinker, or you're drinking every single day, you're drinking for many hours throughout the day, it can have quite a toll on your body. Your liver is one of the organs that takes the toll. And what that does is it's a super vital organ in terms of keeping your body healthy. And alcohol use does damage, and your liver will deteriorate. There are so many health concerns that will happen when your liver starts to go. It can cause a lot of alcohol use can cause high blood pressure, cancer, mental issues, meaning your short-term memory and your mental processing. The list goes on in terms of what alcohol can lead to. Sure that some of you have heard about opioids. That has become quite an addiction throughout the United States. For example, there's heroin, fentanyl, and although so it's interesting how many people get started on that. So what happens is people will have surgery or maybe oral surgery, and they'll have a lot of pain. And in response to that pain, they'll go to the emergency department. And in the past, a physician will observe them and then they'll prescribe the medication. So they might prescribe Vicodin, Percocet. And so as a prescription, people can take those medications, and it's a lot like alcohol. It wouldn't lead to addiction. It might help the pain for a little bit until the pain resolves. But there are some people where the pain doesn't go away, but the medication gives them a high. And what they do is they become addicted. They want more and more medication to stay on that high. And they'll start to go to many different doctors, and they'll get those medications, and they disconnect from the pain. And that's what the medication does. And then it becomes a habit. And that really is a problem that leads to an addiction. The impact that that can have on the body, for example, could be weight loss, addiction, nausea, constipation. And I know, unfortunately, many of you have heard about overdoses, and that leads to death. So I wanted to explain a little bit about opioids, specifically the pain medications. They're really great as short-term use. Those patients who are going through cancer treatments or who have had surgery and need acute pain control, their opioids are going to be useful for those types of patients. But if your body is going to, it has a predisposition to become addicted, increasing the amount of opioids that you use leads to addiction, which is what we see for those people in the community who are addicted. And let's not forget tobacco use with smoking. Cigarettes is still the #1 killer in the United States. It causes cancer. It causes lung disease. It causes COPD. It causes high blood pressure, heart disease, heart attacks. The list goes on. It is a huge impact. Nicotine, which is in the cigarettes, is terrible. It is something that should inspire you to quit. There are others, of course, marijuana, meth, different party drugs out there, coke, I mean, the list goes on. I wouldn't be able to give you the pros, and I wouldn't be able to let you know about all the problems with each particular substance. What's important is for you to recognize within your life, are you dependent upon any substance? And if you are, be honest with your doctor. Go to your family doctor, your primary care physician, or if there's an addiction specialist, and sit down with them. Be honest about what these substances look like in your life. They're not going to judge you. They're not going to stereotype you. They're going to listen and work with you to help you. There are lots of treatment options as well. You need to be able to consider, what's your environment like? What support systems do you have available to you? What's the severity of your substance use at this point? Because really, addiction has different levels and they need different types of treatment. You might just need a 12-step program and a community of people who are supporting you to get through that, to be able to help you wean your use of a substance. But there are other people who might need to go to a detox program, which means they need medical supervision to make sure that they get the medication, they get the substance out of them appropriately because of how long that it's been in there. And they might need a long-term program, 30, 60, 90-day program, to be able to be there every single day to build their resistance. So again, you have different levels of abuse. Your doctor will be able to sit down with you and talk about your addiction, look at what the use is on a daily basis, where some of these connections come from, and how to get connected with resources. The other thing is also looking at other people who have done training with substance abuse. So I think now I'm going to hand it over to Dr. McKee, and we're going to open it up for a Q&A session. So I know we need to take a little bit of help. We have lots of different questions that have popped up for us. Some of them are related to like some of the freezing issues, and so we're trying to work that out. But one of the questions that we have is for Karen and Misty. Either one of you can choose to answer this. Michigan is really challenged in terms of the deaf community finding access to substance abuse and rehab programs. Sometimes we see deaf patients who need help, but we have no idea where to refer them, where they're going to have access to this treatment plan. This might be a similar problem across the United States. Michigan is just an example. So what are your strategies for a patient or a person who wants to find rehab to both find an accessible program to manage their substance use? What are your recommendations, and what feedback would you give somebody who's starting this journey?
Karen, do you want to take this? I can respond.
Well,
this is Karen. Oh, wait a minute.
One second, I'm sorry. I think that Facebook Live had a little bit of a delay, so they want me to go back and repeat that. So again, I want to thank everybody for sharing their stories. And I want to talk a little bit more about for their experiences with drug use and rehabilitation. Our audience has sent us some questions, but for Misty and Karen, I wanted to point out that if you lived in Michigan, where we see patients who do struggle with addiction to alcohol or other substances, including opioids, they have a difficult time finding accessible, meaning American Sign Language, programs, and it's really not great. So what are your recommendations? How would you encourage those people to find both accessible programs, as well as maybe what are the resources that are on your go-to list, or what strategies would you encourage someone to employ to be able to find access, good access to these recovery programs?
So this is Karen. And I think that's a really good question. So I think, oh, what's happening here? Oh, sorry.
Oh, you're good.
Okay. So I think the challenge is to find treatment for deaf, and that happens all over the country. You're not alone there. There are very few that I'm aware of, very few places, and there's a lot of barriers related to insurance and payments, and transportation issues. Interpreters is finding interpreters is a challenge. You're not alone. And even if you can access a treatment program with an interpreter there, you're not necessarily going to find a group or a counselor who understands the life experience that you have growing up deaf. Maybe you're in a family that doesn't communicate with you, and that typically happens. So that really can be a challenge. And so there's not a simple answer to this question. And so I really, think that you should lobby your legislation for programs, money, funded for programs. That's one approach. Sometimes there's a lot more trauma going into a treatment program where there's more barriers. Even if other than not getting any treatment at all. So it's really individual. What kind of benefit could people get from that? I don't know. Misty, do you have other information? Well, I think the best suggestion I have for next step, the best suggestion I have, I think for a first step is to find a place and just go and try and call, use a video phone, maybe email. And the agency I work with, SAISD, a lot of times we can help them find out what resources to get for those people. So I think what Karen said is right. I think what you said is exactly right. There's a lot of barriers. Fortunately, for Rochester in the state of New York, we do have inpatient treatment programs, like residential programs for treatment. And there are interpreters available, and they also have me and some of the other deaf counselors. There's two of us. We contract with them. And so we will go in and work with the deaf patient. And very often what happens, we'll have one deaf patient at a time, and they're really isolated there. And so, the interpreter's not there 24 hours a day. And so the patient, who's the only deaf person, can be really isolated. So the situation can be really tough. And you know what I mean, Karen? So I really wish that, in a perfect world, we'd have peer support and recovery coaches and everybody that was the same. That would be a perfect world, right? Everything would be accessible. Yeah, this is Karen. Yeah, it would be so nice if it was, the assessment and everything else was accessible. People who are hard of hearing, who don't sign, they, sometimes find that things are challenging as well. But it's really important to figure out, because I know many deaf people go into treatment and then they leave after a couple of days because there's no interpreter there. And so after a day or two, they leave because they think, well, what's the point? So I'm more in favor of community-based programs like a recovery coach. Meeting with a person, meeting with them in the community and supporting them there. And sometimes you do need to have additional support to that. But I find that treatment also has its limitations, because there's parts of life that, other things can happen as well. Okay, so I think we're going to go to Michael.
Yeah. And so, Michael, do you mind talking a little bit more about, different resources that you know of? Yeah, this is Dr. Argagny. So there are some states that are very fortunate who have programs where they are specifically tailored to the deaf and hard of hearing community. For example, Boston, Parkland Maryland has a state program. And Minnesota, and I think Rhode Island. So there are a few states in particular. So if you're fortunate enough to live in those states or live nearby, it's possible that you would be able to ask to be able to utilize their programs or work with their providers. And that would really give you much better access. But unfortunately, like has been said before tonight, you know, inpatient programs are much more challenging because most of the time when a patient goes in to a hospital for a long-term treatment program, it's all day, every day, and it's really a lot of discussion-based anger management classes, addiction management classes, depression management classes, right? There are a variety of topics, but it's challenging if you don't have access because you sit there, people are talking all around you, and you're not really participating. Yes,
And
go
this
for
is
it.
Misty. I would like to add something. Oh,
Yep, sorry, I just want to wait till you're up. Thanks, Misty.
yeah. So I do want to add something to Michael, what you just said. The other challenge about a deaf person getting into either inpatient treatment or really any type of treatment is that sometimes the interpreter doesn't always understand what the deaf person, what the deaf patient is saying because of some language. I don't want to say this, but just language limitations sometimes. Maybe their background, their education level might be a little bit different. And so if somebody's signing very well and an interpreter can't follow that, or the other way around. And some people don't have any language. And so sometimes people have to have a lot of patience because they might draw things out so that the person can understand, draw out no drugs, and this is what it does to your body. And so, it can do this thing to your liver, and really be able to go in and explain to somebody. So it might be some simple idea, but it might take an hour to explain, and it can be exhausting. So language deprivation and access to information sometimes can really be a problem, and it really varies with people. Karen says, yes, that's exactly right.
Okay, thanks again, everybody. With limited resources out there, can really be a challenge. But I know a lot of people out there are hoping to see your success and see that that can be successful in their states and their environments as well. Clearly, there are some things that are more successful than others. There's a very unique situation, though, in terms of using ASL for communication. So it's worth it a try to reach out and ask for help. Push the insurance companies to get approval. Even if a place is out of their coverage zone, you can still push for insurance to cover because of your unique needs. Another question that we had come up in the chat is regarding support groups in ASL. For example, Alcoholics Anonymous, Narcotics Anonymous, and others. If they're out there, where does our deaf and hard of hearing community go to find them? Karen, can you take this?
Let's see. Okay, yes. Right now, there are many support services that are happening through Zoom. So you can find a list through Facebook. There is a deaf recovery community, DRC. And so you can find postings, Facebook listing about where meetings are happening. Some of them have interpreters. Some are without interpreters, but everybody signs. And so there's a lot. In my state of Massachusetts, we have a group called Thank God We're Sober. So we are running it. It's a 7-day, we have programs every week. There's some in San Diego that run every night that everybody signs. And there are resources that are available on Zoom, but in-person meetings, that happens in different states. Massachusetts fortunately has interpreters for people who want to come in to do a kind of an in-person meeting. There are a few of those that are starting to open up again. But I feel like the Zoom opportunity is probably here to stay, because I think it's just been a perfect thing for deaf people to access.
Great. Thank you so much, Karen. Next question, which I want to send to Dr. Michael, which was in terms of health screening or monitoring. Do we have to get something from a doctor that's not related specifically to an addiction program? So where do doctors get screening? For example, like you have an infection. So what are your recommendations for that if somebody wants to get screened? I'm happy to answer that. I guess it depends on the substance. For example, when I was talking through my part about alcohol, alcohol takes a toll on the liver. So if you have a history of drinking a lot of alcohol consistently, then the risks for liver damage is higher. And so a doctor could then send you for some blood work to look for certain markers. And if those markers are high in specific areas, then they might take an in-depth look at your liver. And so, for example, an in-depth look might be an ultrasound of your liver. Other kinds of drugs, for example, if a person uses needles and shares those needles amongst other users regularly, and there's concern about whether or not they're clean, or the areas that they choose to inject might become infected, which would lead to inflammation. There might be other sorts of blood infections that result. HIV is something that can be passed around. Hepatitis C is another disease, another virus that can be contracted. And so really using a person's history and what kind of drug or substance they use. And it doesn't mean even that the person has an addiction, just means that they have a history of using that. There are sometimes people who have experimented where they've just wanted to try a certain drug. And even that limited use can lead to an infection. So it's important to get checked out so that you can continue to be healthy. Thanks everybody for your expertise, but it's amazing how fast the time has gone. A couple of things I want to add in relation to this Deaf Health Talk. Again, this is a monthly talk. Next month, it will be on the 4th Tuesday of September from 8 to 9 p.m. Eastern Standard Time. So please share this with your social networks. It's completely free. And let us know what topics you think our community needs to learn to focus on. The next topic we're going to do is pregnancy and reproductive health. Again, we'll have different presenters join us for that. So if you look in the chat box, you'll see that there's email information, and so it's listed there for you to be able to reach out to us. I would like to thank Bettina Barilla, and I'd like to thank everybody else on the support staff for their help as well. But before we close, I just want to give any for our presenters a chance to have any closing remarks. If there's any words of wisdom you want to leave us with.
This is Karen. Okay. Really, I just want to say thank you and let everyone know that recovery is possible. It really is. Yeah, it works. And life can get a whole lot better when you're sober and you're clean. And you can find happiness and you can find different ways to solve problems and frustrations that used to really cause a lot of problems for you. They're doable. You can go through it and you don't have to do it alone. You can ask for help. So, and that's all I wanted to say. Thank you.
Okay, anybody else have anything you want to add? No. Okay, thank you so much for your time. We will see you at the next FL Talk. This recording is going to remain available. So if there was somebody you know of who couldn't join tonight, maybe they had something else going on at the same time, they're able to watch this talk on Facebook. And this event will be saved for future viewing. Thank you, everyone,
Woo!
for making tonight happen.
Yay.
Yes, absolutely. Have a
Good
great night,
night.
everybody.
Bye-bye.
Stay safe, stay healthy. Bye-bye
Yeah,
now.
you all too. Bye-bye.